going on, fam? And welcome back. Do you ever wonder whether it's better to attend therapy in person or via telehealth? This is a question that I get asked many times by new clients or potential clients when I'm scheduling with them. They often ask, what's better? What's the better option? So I figured I would just bring to you guys some points, some things that I tend to consider when I think about telehealth versus in person. So really, there's not a very big difference in terms of the quality of service that you get when it comes to telehealth versus in-person therapy. The biggest thing is whether you're at home or whether you're in an office. So I figured I would go over some pros and cons of both modalities. Telehealth is a good option for what I would consider obvious reasons. Economically, you don't have to drive, you don't have to use gas, you're not using an office space, right? You literally just go from one room to another, turn the computer on, and you're good to go. When it comes to in-person therapy, you're guaranteed a calm, quiet, therapeutic space. I like telehealth because I can share documents. So a lot of the time, especially if I'm on Zoom or another platform that allows me to screen share, then I can go through documents with my client. We can go through, worksheets and checklists and handouts, and we can read together at the same time in real time. I don't have to print anything out. I can literally just screen share, and I'll send them the document if I think they need it or if they ask for it. It's a little more tedious when you're dealing with in person, but it's really not that big a deal. I can also send them the worksheet. I don't have to use paper to make that happen. As far as the types of client that I prefer for each modality, I tend to prefer clients who have difficulties with attention, difficulties with organization, preparation. I tend to prefer those patients come in. Also children, kids who usually typically under the age of 8, I prefer that they come in because we can play, right? They come in, there's a lot of hand games. I got Uno and Candyland and all these other games, and they can come in, they can draw pictures with me. So it gives them a lot more opportunity to interact with me instead of sitting behind a screen and talking to me. I also play games while we're online, but I like that more interactive, you're right here, I'm right here, we're looking at the same thing at the same time in person. So I tend to prefer that for clients who maybe need more tactile engagement, even more visual engagement. If we need to switch it up real quick, we can. I keep journals on hand. I use a lot of sensory products, so I will allow them to explore their own sensory needs. They can use Play-Doh. We make sensory jars. I do arts and crafts with the kids, so they get to kind of explore the things that make them feel good, what kind of calms them. For telehealth, I tend to prefer clients who are highly motivated. They can kind of keep themselves on track together. If I send them homework, there's no question that they'll at least look at it, even if they don't necessarily do it. Definitely prefer if it's going to be like a brief therapeutic process. A lot of people struggle maybe with just adjusting to a new norm, or maybe they're getting over a breakup, or it's something that with a few months of talk therapy, we're kind of going through the exercises. We're doing a little bit of cognitive restructuring, but it's not like really in depth. I tend to prefer that they be online because I'm only in person 2 days out the week. I tend to prefer that my in-person clients be people who I'm gonna kind of be with for a while. So I hope that helped. Not a very long video today. Honestly, the question always comes down to what works best for you. I have a really busy schedule and it's hard for you to get from point A to point B, and then you want to add a therapy session in between, and telehealth would be more convenient for you. Do a telehealth. If you find that your home environment is a little too noisy or too distracting and you really want to make sure that you're getting the full benefit of your therapeutic experience, come on in. And there's also nothing wrong with switching. So I've had clients who started off in person, preferring to be in person, and then they try telehealth and they're like, oh, I want to stay here with telehealth. And then I've had telehealth clients who decide, you know what, I think it would be better for me to come in person, and they come in person. So there's nothing wrong with switching it up. I do like the flexibility. Most therapists will allow you some flexibility. So if you're unable to come in person on a given week, there's usually an option to have your session online. There's usually an option to have your session online. The only other point I would make is if you do decide to do telehealth, please, please, please take it just as seriously as you would if you were coming in person. One trend that I do notice amongst my telehealth clients, a lot of them are latecomers. Not everybody, but a lot of them tend to be, they get on 10 minutes late, 15 minutes late. Sometimes I have to chase them down, find out, are you joining your session? A lot of the time they forget. I don't see that as much with my in-person clients because the benefit and the curse of the flexibility is that when people know that there's flexibility, they can take advantage. And so depending on the client, depending on how often it happens, sometimes I have to kind of put my foot down and go, you missed more than 15 minutes of your session. You missed your session today, especially if it's something that's ongoing. But when people know that they have this much time for an in-person session, they seem to be a little more diligent. You need to make sure that your device is booted up. You need to make sure that you have the link and that it's the right link. If it's, most of my clients have a recurring link, so they don't have to worry about it. But if you need it again, you should check before your session. So again, I've had clients miss half their session because they can't find the link, and I'm sending it over and over again. And it's like, dude, but check and make sure your internet works. Check and make sure that you are ready and prepared to have your session. Just because you're at home doesn't mean that this is not a professional environment for this purpose at this time. So yeah, that's pretty much what I got. So I hope this video was helpful. I hope that if you are pursuing therapy, if you're seeking therapy, that this kind of gives a little bit of insight as far as what you can expect, the questions that you can ask. And really the biggest thing when it comes to telehealth or in person is communicate, communicate, communicate. If you need to switch things up, if you need to cancel a session, most practices have a 24-hour cancellation policy. So, don't just decide today I'm not really feeling therapy, so that's it, I'm not doing it. Make sure you're communicating with your therapist. So thanks again for watching, you guys. I hope you have a great rest of your day. Take care.